said, "You're a crook, you've overcharged, you owe us this much money."
In the small rural town of Pollocksville, North Carolina, exists a medical practice whose story is one of uncertainty, defeat, and triumph. This practice, serving 80,000 patients over 3 counties in eastern North Carolina, fell prey to the federal government's flaws in monitoring fraud and abuse, and as a result experienced a misfortune that forever changed their practice of medicine. ECIM was founded in 1971 by Dr. Neil Bender.
I'm from Pollocksville, and so after I graduated, I really didn't think that small town would support really quality medicine. And so I went to another town, worked for 3 years, which I enjoyed, but then I felt bad about not coming back, so I came back here to be really just to have a clinic where maybe get one more doctor and be a country doctor and take care of the situation.
Dr. Bender was from Pollocksville and had always promised his family that he was going to bring medicine back to his hometown, and that's what he did. His wife, Mary Dale, at the time, was his nurse here. They had 3 rooms in the motel. 1 was the office and 2 were his exam rooms until he got this piece of land here from a local farmer.
On October 21, 2008, Eastern Carolina Internal Medicine, or ECIM, now known as Carolina East Internal Medicine, received a notice of overpayment for Medicare claims amounting to over $1 million from Cigna Government Services, or CGS. This amount was based on the post-payment review from Advance Med, a program safeguard contractor for the Centers for Medicare and Medicaid Services, or CMS.
The first impression of hearing that you're having an audit is that there's a potential threat to your practice, in that someone is coming in to look at what you're doing. Not that you're concerned that you're not doing things properly, but just that there is a certain scrutiny that makes anyone uncomfortable having to be under a surveillance like that.
After the initial fear of just being told that you owe $1 million and the impact that that has on so many lives involved, not just our physicians' ability to practice and to remain in practice, we're concerned about, are we going to be able to meet our patient needs? Are we going to be able to continue to employ our staff members? There's a lot of these things that are going along in your mind that you have to, first off, we have to be reactive and figure out a way, to keep our doors open, continue to serve our patients, as well as figure out this process that we knew very little about until we got this notice.
The first thing you think is they're calling you a crook. They say, we've taken this many charts, reviewed them, and there's this much that you ordered, basically in simple language, that you ordered that was not needed. So you were over-ordering tests. If you multiply that by fact how many people you see, you owe us $250,000. And by the time you took 3 other doctors, you owe us $1 million.
The first process, we had to calm the fears of our physicians, because we didn't know at that point would there be other physicians that would be audited in this manner as well.
Adding to the problem, Advance Med asked for these records without having any direct contact with the practice.
Our first contact, they had asked us for records on approximately 50 patients for 4 of our physicians. They had asked for records on a particular date of service. We gathered all of our medical records, the physician notes, the nurse's notes, and sent to Advance Med.
They had asked for, give us the order for this test, the diagnosis, and a copy of the results. Basically just to see that it was done and it was the medical necessity according to the diagnosis that was appropriate for the appropriate procedure, and a copy of the results.
When you finally got to look at some of their questions that they had, some of it was after you had an opportunity to kind of look at the charts and some of the things that they were auditing, you couldn't understand what they were looking at or what the problem was.
Now, our practice did take time to make sure that before these audits were even on the radar, we were looking at what we were doing to make sure we're doing a proper job. We had 2 separate consultants come to the practice in years preceding the audit to look at how we were coding and to see if we were being appropriate. And what we found out at that time was that they told us we were undercoding consistently.
CMS used an extrapolation formula to determine the error rate in the selected claims and to arrive at the overpayment amount due. In this case, $40,000 worth of overpaid claims turned into a $1 million balance owed by ECIM.
They asked for records on 200 of our patients, approximately 50 patients for 4 physicians. They figured up, they said, okay, we have overpaid you, Medicare has overpaid you approximately $40,000 for these 200 patients. At that time, they used something called extrapolation, where they take these 200 patients, they take their error rate that they had determined, extrapolated $40,000 to be over $1 million.
Upon receiving the overpayment notice in mid-October, ECIM filed a request for redetermination with CGS on November 20, 2008, and submitted explanations refuting Advance Med's findings. The requests were not entered into CGS's computer system until December of 2008, following inquiry from ECIM. The practice also filed additional medical records and an independent review of audit findings with CGS later that same month in order to support their disagreement with Advance Med's review.
They never had an interaction with us. They asked for a particular note on a particular date of service for a specific patient.
At this point, they started to recoup our money that was coming in from Medicare. 40% of our revenue had just been cut off.
A clinic in Pollocksville is not exactly equipped to pay $1 million back in a 9 to 12 months.
So at that point, we had to go to our financial institutions, secure some loans in order for us to meet our obligations here as a business.
The impact of the Medicare audit was detrimental to this practice's physicians and staff, their patients, and the community.
Patients' access was inhibited here because we had to call these patients up for the 4 days that our physicians were out of service. We're having to call up patients that need medications, that need to be seen for acute problems. And here there's not a whole lot of other places for them to go other than ERs.
The cry and scream of everybody that was out there wanting to get in to see you, where are you? If you take a day off around here, it's a paradigm event because patients just don't get seen.
Because we already are in a shortage of primary care physicians, especially in the rural areas, not only in North Carolina, but throughout the country.
In August of 2009, CGS issued an unfavorable notice of redetermination to the practice, which meant that they did not pass the first-level appeal. In response, ECIM submitted a second-level appeal in October of 2009 through a reconsideration request to Q2 Administrators, the qualified independent contractor for CMS. Q2 Administrators' findings showed that some of the reviewed claims were submitted correctly, while some were not. In January of 2010, ECIM was informed by letter that they now only owed approximately $800,000 instead of $1 million.
And so there also was a feeling of that this was a very unfair practice, that the audit was very unfair in that you were presumed guilty of cheating or making fraudulent charges when in fact this was legitimate work that was done and we had been paid for, and that was taken out of our pockets, literally.
In some cases, they were looking at a progress note where I had ordered a CAT scan and had given a reason for it at one progress note. But in the interval between the procedure being done, the patient had come back to see me again. And they only looked at the note preceding the procedure, where they might have been in there with a sore throat, cold, or something like that, and I treat them for the sore throat, cold, or sniffle, and then they think that's the note that applied to the procedure that I ordered. They didn't go back to the one that happened 3 days earlier, where the patient was in, where the CAT scan was ordered because the chest X-ray showed that there was a 3-centimeter mass in a person's lung. Okay, no, they look at the sore throat and cold and sniffle, and they were so non-diligent when they ordered when they looked at these charts that you sit back and you just kind of said, wow, You know, they're forcing me to pay this kind of money on a lousy audit procedures.
To further prove their innocence, ECIM took measures to prepare for the third-level appeal by requesting a hearing with an administrative law judge. The hearing was held in September of 2010. Neither CMS nor the other contractors were present at the hearing.
Every single test that we do, we document and chart why we want it, why we need it. But what they did is they took the day the test was done, looked in the chart to see if there was a reason for it. And obviously, if you know anything about charts, you know the reason for it may have been 2 weeks before, 1 week before, might have been afterwards. And so there was every one of them we felt there was a definite reason for it. We explained why we needed it, explained why it was needed.
The administrative law judge had 60 days to make a decision on ECIM's case. In December 2010, the administrative law judge ruled in favor of ECIM in over 90% of the reviewed claims.
The administrative law judge findings was reduced down to approximately $3,400 in that ballpark, which was a significant amount less. And when you reduce it down to that amount, the error percentage that they use in this extrapolation process should also come down as well. So that was our final finding, was around $4,000.
We stopped making monthly payments once we received the administrative law judge's ruling. The next month, CMS sent us a letter saying, hey, you didn't make your payment to us, you owe us additional money. We immediately contacted them and said, no, the administrative law judge ruled in our favor, sent a copy of the ruling to us and a copy to CMS. We're waiting for you to pay us back the $700,000 that we have paid you. At that time, the person we spoke to on the phone says, well, we don't have a record of the administrative law judge's ruling in our file. So we immediately had our attorney send CMS the administrative law judge's ruling to the person we were talking to at CMS, at Medicare.
Even after the practice contacted CMS to inquire about the refund, it took a United States senator to get CMS to pay back money that the practice shouldn't have paid in the first place.
Ultimately, it took the intervention of a U.S. senator for us to get our money back that was paid unnecessarily to the government.
It is unfortunate that a program created to prevent fraudulent Medicare payments has negatively impacted so many practices across America. Murray Gilgo, Greg Holton, and the 4 physicians who were under review, along with their entire practice, spent 4 years of their lives fighting against claims that forever altered the services that they can provide to their patients.
We've been on the forefront. The history of the practice is to be on the forefront of both treatments, but as well as practice styles and using technology to improve the quality of what you do, and which is also very expensive to do. And this made it impossible for us to continue to do that.
We had enormous amounts of administrative time through nurses, through other administrative personnel, gathering documents. We had days of physician interaction and review of these documents here, preparing those for the administrative law judge. I would guess that we spent at least $300,000 in defending this claim.
So the process is a practice killer and is a threat to independent practice of medicine all over our country.
After 40 years of private practice, ECIM integrated with Carolina East Health System and became Carolina East Internal Medicine in 2011. Although the decision to make this change was not a direct result of the Medicare audit, the uncertainties that unfolded were a contributing factor of the practice being sold.
I think that the result of this entire process and fighting this audit hastened the demise of our independent practice and made us in a vulnerable position where we had to have some other way to continue seeing all patients in our community, short of closing our doors.
Even though the entire Medicare audit process was severely disruptive, ECIM's main concern was the safety and well-being of their patients and community. This practice has grown from their experience, and now the federal government, as well as practices throughout North Carolina, should learn from it too.
But it's one thing if they'd have said, you know, we've got some problems here, we want to look at more of the chart, let's look at this and let's see, and we'll check and see. That'd be one thing if they said, we need to investigate this a little further because we got some concerns. And so then you would have a chance to explain to them whatever the problem was and you could work it out. That's not what they did. They said, you're a crook, you've overcharged, you owe us this much money.
If there's fraud out there, sure, it should be caught. But one way to improve this in our minds here after going through this is to improve the efficiency by having the auditor actually come down in person to review the records. If they're here on site and can look at a patient's record, and if they have a question, you know, we can answer that at that time. We can have the physician here at that time, you know, to intervene and to say, yes, here's the reason why this was done, rather than all of this to be handled through the U.S. mail, back and forth. There is no human interaction involved in this process at all. Nobody to speak to until you get to the administrative law judge level.
The federal government needs to hold the independent contractors accountable for their actions. They should not be under an incentive to find things that may or may not exist.
And you know, I'd heard stories of practices that just closed their doors. That's what they did. They did not fight it. They could not fight it. They were overwhelmed by it. And so they gave up, and so all of a sudden the community loses a practice.
The NCMS and the Physicians Advocacy Institute are committed to helping practices like ECIM. In times like these, where our healthcare profession is constantly evolving and Medicare reimbursements are often uncertain, it is important now more than ever to fight for your profession.
You have to fight for this. You know, we were fortunate in that we had the collective resources of our 35 plus physicians here where we could go out and to secure the resources, whether it be legal, consulting, financial institutions to help. In a 2 or 3 man practice, I'm not sure how they're going to handle that, but they all need to fight.
The main advice I would say is that you have to fight it, because if you did something that you feel is right, the practice that you did, you need to defend it, because it's a financial issue, but it's also an issue of the honor of the profession.
The NCMS and the Physicians Advocacy Institute strongly support efforts to eliminate fraud and abuse in healthcare, but do not support reviews that are handled in such an inaccurate manner that it negatively impacts an innocent practice and begins to affect the quality of care that is provided to patients.
And I think the final thing after two years, 2 or 3 years, or how long it was, showed that we were right.